Our fight against COVID-19 has been at risk. As many of you are aware, the Attorney General had filed a motion to try to void every single executive order that had been put out to fight this pandemic. That would mean every single set of rules that keep people safe, but it also means things like workers' compensation for our first responders when they're quarantined because they've gotten the virus or been exposed to the virus. It was also almost every bit of flexibility we've been able to offer to our schools during this pandemic. It was everything from, if you'll put up the executive orders, the civics test requirement that when we had to stop our in-person classes, not everybody had taken, would have prevented some from graduating and would throw those individuals' degrees in doubt now. It would have been the end-of-course examinations that we were able to waive, allowing our seniors to graduate this last year, even though they could not be in person. Without a ruling we're going to talk about today, those degrees would have been in doubt. It would have been the suspension of the NTI limit, how many days that schools are even allowed to provide instruction via computer and other means, meaning schools would not be allowed to have provided more than 10 days to kids, and after that, either force them to return or not provided it at all. It would have been the change that we had to make so that schools could continue to receive their funding, because their normal funding, called the SEEK formula, is based on numbers of days that kids are in school, therefore depriving all of our school districts and schools out of hundreds of millions of dollars. And it would be the emergency order that we have put in right now that gives these districts more flexibility as they are deciding what to do as we approach the current school year. So until about an hour and a half ago, we faced a horribly uncertain future, where a request had been made to have zero rules, the Wild West, no requirement to wear masks, even though Alabama and now Colorado have done it in just the last couple days, without requiring businesses to do the cleaning that would make sure that you don't catch COVID-19, without the requirement to even wash or sanitize your hands. It threatened all of the extra support that we've given to our first responders, and it would have devastated our school systems. But thankfully today, the Kentucky Supreme Court put in an order a little less than 2 hours ago that is going to prevent any orders from these lower courts that would restrain these things we've done to keep people safe from going into effect. That means all the orders, including the mask order, are currently in effect and will be until everything can be fully argued and briefed in front of the Supreme Court. I'm not excited because that is or could be perceived a win. I'm relieved. I'm relieved because I've sat up the last 2 nights not sleeping, worried about how many people would die if we didn't have any types of rules in place. I stayed up the last 2 nights not sleeping, wondering how many of our first responders would show up if we didn't have the authority to help them when they're down or get hurt. I've stayed up the last 2 nights wondering what our school districts could do. And could they make a real decision, or would they be so financially strapped they'd be forced to make one? There is no question that without any rules, because every state has them, that 2 weeks from now we would have seen a major proliferation of cases, and we know more cases means more death. So I stayed up the last 2 nights worried that we had a battle of life and death, and if we lost it, it wouldn't be me who paid for it, but it would be so many other Kentuckians. And so what the Supreme Court has done has ensured the safety and the lives of Kentuckians, while at the same time saying they'll hear all the substantive arguments later. And I'm happy to do that, folks. You know, these are emergency powers that are provided by the legislature to the governor to respond in a time like this. But if we want to argue in front of a court, let's do it. I'm not afraid of courts. That's what I used to do. But let's make sure along the way we don't risk the lives of Kentuckians in the process. I think the Supreme Court found that balance, and hopefully that means we can move ahead protecting people, and anybody who wants to be heard can be heard. And let me just address the silliness, because you all have seen me up here more than I ever intended to be, of love and power or doing this because of power. It breaks my heart every day I'm up here and have to talk about the people we're losing or that we might be moving in the wrong direction. I want to get back to the old normal as much as everybody else. This has been the hardest thing I've ever had to do in my life, just like I know this is the hardest thing that just about every family has had to go through. I have lost people to this virus. I know I will lose other people to this virus. I have friends like David Turner, who came the other day, who desperately needs you to wear a mask, because if he becomes infected, that's probably it for him, and he deserves much better than that. And what we're seeing, and thankfully, we're going to be able to make sure we can keep rules and restrictions in place, is this thing can spread, and is right now, so fast. I want to give you one example of community impact that occurred in one of our counties in just one football team. Just one football team related to a weight room where masks were not being worn. And remember, if you're inside, you're 6 feet apart. You're not 6 feet apart, it can be a real problem. And I'm sure that this team tried their best. But one football team out of the weight room, 18 players, 3 coaches, and then that infected 15 extra family members. Remember, when we're looking at these things where people aren't following the rules, it's not just if you're there and if you make the decision to be there. It comes home. It comes to other people. And this is just one example of why wearing a mask is absolutely critical. And it shows you what could have happened this weekend if nobody had to do any of this stuff, or whether it had been weeks from there. So let's just take this as another lesson that we're living in really dangerous times. But here's the great thing. We know what we can do to lessen its impact. We know. There's still a lot we don't know about this virus, but we know if we wear masks and socially distance, clean our hands, spread out, reduce the capacity in certain areas, and do more outside, that we can protect people and save lives. That's a pretty simple formula if we have the will to do it. I was also very concerned because we are seeing an escalation in Kentucky. We look around the country and what we are seeing is heartbreaking. I'm not using Arizona and Florida and Texas as examples. I hurt for them. Those are Americans too. We all know people that are living in those states, and what they are going through right now looks like they will be devastated even more than New York was. Florida, another 11,000 plus cases today. Texas and Arizona with having to take steps that we never want to. And while we are not there, we are seeing more cases in Kentucky. We want to talk about how important it is that these rules are still going to be in place. We have the third highest number of positive COVID cases today that we have ever had. The highest number was on May 5th. It was 625, but over 300 of them were from a prison that we tested and got them all back in a day. The second highest was July 14th, not that long ago, 576 cases. Today, we're reporting 531 new cases of COVID-19. Now remember, the number of positive cases typically trail the initial infection by 10 to 14 days, and that's if there is a quick turnaround on the test, because you don't know you have it. You get symptoms or you get tested. It takes a couple days for the test to get back, and then you know, and then it's reported to us. So the world that we have these 531 cases from is a world that is at least 10 days old. That's why we want everybody to wear a facial covering. Hopefully it means 14 days from now, we see very different numbers that are much lower. We have really good compliance with our facial covering and other orders, then these numbers will come down. And if we have people that stop going to the beach or on vacation in really dangerous places, that'd help too. Our 531 positive cases are out of a total number of, are now add up to a total number of cases of 21,605. That's out of 522,267 overall tests, and a positivity rate of 4.19%. Once you go over 5, they start saying you ought to consider rolling back some reopenings. As of today, we have 452 people in the hospital for COVID-19. We have 89 patients in the ICU. We do have 6,772 people that have recovered, and for that we are grateful. New cases by county: Jefferson 83, Fayette 40, Warren 29, Madison 18, Kenton 17, Boone 16, Hardin 16, Hopkins 15, Campbell 14, Christian 14, Davis 14, Jessamine 11, Casey and Oldham each at 10, and a lot of other counties on here. Bell has another 9 with everything that they've already had to deal with. Ohio another 9 after they clocked in at such a high number the other day. Graves 8, where you continue to see a huge number. Clay 7. Given the population, we have seen really high numbers. So incredibly important that we stop this where it is right now. And beating COVID is not about a governor or an attorney general. It's about the people of Kentucky. It's about us coming together. And at the end of the day, we won't look back at any of the drama. We'll look back at the loss of life. We will look back at whether we were able to keep our economy open. We will look back at how much did our kids suffer and were we able to get them back in school. My 3 priorities, why I'm doing what I'm doing, is to protect the lives and health, because this thing hurts if you get it, of our people. Restarting our economy, keeping it open. It's why the Chamber of Commerce and the Retail Federation support the mask mandate, not a suggestion, a requirement, and trying to get our schools open. It's going to be complicated, but if we can't keep our cases down, you can't open schools. Today, we're also reporting 8 new deaths related to COVID-19. That brings our total number of deaths to 653, more than we ever wanted to lose. Still less than we had thought we would initially. But remember, sadly, deaths follow cases. More cases, even if we're doing a better job, more death. So let's make sure we keep our cases low. Our deaths today include an 85-year-old man from Bell County, an 84-year-old man from Carroll County, a 70-year-old woman from Casey, an 83-year-old woman from Franklin, a 73-year-old man from Jefferson, a 75-year-old man from Fayette, and we have another 2 individuals in their 60s, which it just seems that we are seeing more and more, a 60-year-old woman from Jefferson and a 68-year-old man from Muhlenberg. Let's turn on those green lights. Every night I look out the window, I see the Capitol Dome lit up in green. It's a reminder that we are still in this and that people are still dying. It's still serious, and we need to put fighting this virus ahead of us, ahead of anything personal. We just got to get the right thing done. Next week, we're going to show you, I think, some numbers and some trends which we want to see on recent infections by age, because we continue to see far too many children under 5 now coming up positive with this virus. Today, we have 10 kids under 5. We have 3 kids under 1 year old. And we have 2 kids that are just a year old. So my kids now are a lot bigger than that at 11 and 10. But do you remember the first time your child got a fever? I mean, inconsolable, difficult. You don't sleep. You sit and worry. You wish you could take it from them. Now imagine you're a parent that has a child with COVID-19. We do our best not to spread this, then parents don't have to go through that, and these young kiddos don't have to go through that either. Race and ethnicity, overall cases, 84.26% non-Hispanic, 15.74% Hispanic. We still see significant spread in our Hispanic communities. By race, 77.77% white, 12.64% black or African American, about 3% Asian, 5.78% multiracial. And then on deaths, 95.74% non-Hispanic, 4.26% Hispanic. That tracks about the population. But then on race, 81.3% white, 14.8% black or African American. That's down a little, but it's still disproportional. 1.46% Asian, 2.44% multiracial. A couple of other updates: long-term care. 4 new long-term care facilities have at least one positive case. 25 residents additionally have tested positive, 17 staff, and 1 additional death. On Kentucky child care facilities, 4 additional facilities have at least one case connected to it. Doesn't mean it's in it, it means connected to it. 2 additional staff and 2 additional children have tested positive. All right, it is Friday, and I don't know about y'all, but it's been a long week for me, and I want to get home to my kids and my wife. So we will open it up for questions, and we'll save any other updates until next week. We'll start and we'll go all the way through. Mark, why don't you lead us off?
Were you expecting a Supreme Court ruling today, and when you read it, when the words sunk in, what was your reaction?
The question is, was I expecting a Supreme Court ruling today, and what was my reaction when I read the words? So yesterday, the middle of the day, we received an email that responses needed to be in by 4 p.m. yesterday. So we thought that there was a chance that we would get that ruling today. My reaction was relief. We know if you don't have requirements for hand sanitizing, we know if we don't have requirements for the type of cleaning you need, we know if people don't have to stay 6 feet apart or you wear masks, we know that if you fill up an entire stadium of people with no rules whatsoever, we know that that spreads the virus. And so my biggest fear was that we were going to have a period of time where we didn't have the tools we needed to fight this war, that we removed the ammunition from our troops and said, good luck with the enemy. So I'm just relieved. I don't even know if I'm happy. Honestly, I'm still fighting, and we're all still fighting COVID-19. I'm just relieved. Everybody still gets their chance to go to court. I hope this shows people it's not about me. I'm just relieved. Chris, and then we'll go to Morgan.
A 2-part question. The first one is, General Cameron just a couple of hours ago told me that his effort was not about opposing masks, but was about making sure things were done following the Constitution, and that you had overstepped your powers. So that's my first question, is what you think about that. But the second is, will you argue in front of the Supreme Court as a sitting governor, knowing that we've seen you there before just about a year and a half ago?
2-part question. The first is, the AG says it's not about his opposition to masks. Come on, Chris. If he wins, nobody has to wear them. There are no restrictions that are out there. People are harmed. And it's an attempt to prevent any executive order from me at all and to freeze them going back in time. Come on. I mean, if somebody's trying to overturn rules and restrictions, they may disagree with them, but at least get out there and say you do and understand the ramification of it. The second is, am I going to argue in front of the Supreme Court? I've frozen my law license while I'm governor. I cannot. Oh, it might be fun. I always enjoyed what I did, but I'd have to go back and take a whole lot of CLE between now and then, which I'll have to do when this thing's over. No, I think as governor, while these are really important, every day I'm making decisions from economic development to the rest. I think that chapter of my life is probably over, but I enjoyed it each and every time. But this, I don't think I would. I mean, when I went to court, when I was arguing with Governor Fletcher, it was about cuts to higher education first. That's really important, but it's not an immediate life or death decision that we were looking at right now. We were arguing about powers to blow up boards and whether it gives the governor too much power. It wasn't life and death in the middle of a health pandemic. I will say that I'd like to think that I would have understood the stakes that we're looking at right now. Morgan.
Part of the argument that Attorney General Cameron and the argument attacking the court is that procedural, saying that you haven't followed the proper legal procedures to go about issuing executive orders. Can you address kind of how you approach the procedures on this?
So the question is that part of the argument from the AG is that I haven't followed the procedures. That's not their argument. They say that the power to issue executive orders under an emergency, that's Chapter 39A, that the whole thing's unconstitutional. So it's not how we've done it, it's that we can't do it. And if you read the order from the other day, what they wanted is they didn't want us not only to enforce the ones we had, but we couldn't do any moving forward. And remember, this is a whole group of statutes passed by the General Assembly that they were saying is unconstitutional, not my procedure under them, but the powers that the legislature tried to give us. So listen, this isn't a, we wish you'd called me more and then you could do what you need to do. I mean, that's silly and we ought to be beyond it. Now, the positions that we're taking are you shouldn't be able to do it at all, and we hope people will wear a mask. We're far beyond that now. And the ramifications of this with our escalating cases, where if we turned into Texas, I couldn't do what their governor is doing right now. And that'd be frightening. But we don't have to worry about that. And I don't want to get too caught up in it. I know that's probably the topic of the day, but I think what's important here is that all these things that keep us safe are going into this weekend and are going to be in place until we get this thing fully briefed. And what does that do? It's going to save lives. It's going to protect $10 billion of our economy. That's not my numbers. That's from Goldman Sachs. And it gives us a chance to open our schools. I will tell you, we were flooded with calls, the lieutenant governor and others, from superintendents saying, how the heck am I going to have our students wearing masks when they're in the hall, which we can't open school if we don't do, if people aren't wearing them when they're going into retail stores. So you got to live with the ramifications of the argument you make, and these were frightening, absolutely terrifying.
When those arguments will happen in front of the Supreme Court?
So the question is, when will the arguments happen in the Supreme Court? So what I believe the Supreme Court said after saying that this is a critical time to have consistent public health policy, and that the legislature granted broad authority to respond to an emergency to the governor. After that, they said that we're going to let the lower court create a full record, and then we'll look at it. So it means there's going to be some proceedings in the lower court. There's going to be factual records that are created, and then it'll eventually get to the Supreme Court. And again, I don't think this is anybody picking sides today, and I'm not going to jump up and down. I'm just relieved that in the interim on this, that people are still going to be safe, doing the things that every other state is doing the things that Texas's governor says they've got to do to prevent the more freezer trucks from pulling up because the morgues are full, doing the things that Alabama's governor did yesterday or Colorado's governor did today. I mean, we're fighting the same fight as other states. We got to have the same tools to fight it. Yeah. Huh. The question is, would we be in the place that we are at if there was a federal mask mandate? There's no question that a lot of the cases that we are seeing in Kentucky is because other states didn't take the same steps that we do. COVID doesn't care about our borders, and our people leave our borders to go to other places. I also think we slipped some in our day-to-day behaviors. I think we did. And I think everybody looking around can see that. We got tired. We didn't want to wear a mask anymore if some folks were doing it voluntarily. And we reopened different things which give us more context too. And all those things happening together, I think, are why we are escalating. It would help if people stopped going to the beach. Do I think a federal mask mandate? Well, first of all, a federal mask mandate would reduce cases if everybody is wearing one. But I haven't looked at the legality of it. I don't even know if the federal government can do it. I'm just in charge with Kentucky, and I'm gonna do everything I can to protect him. I will say I do want the president to wear a mask. I think that if he wears a mask, there's a lot of other people out there that'll wear a mask. And whether how he feels about it or what he believes on the science about it, I just know that if he does it, It's going to protect a lot of other people out there, and it's just one, to me, Christian act that can be done that you know is going to protect people, even if you don't like it. Tom?
The Northern Kentucky case, really confused on that one.
Me too.
Okay, subpoenas of health department. Unemployment. What's that?
So the question is about the Boone Circuit case, and Tom asking about all these things that went on in the hearing and what was allowed, and we'll get to argue this ultimately when it gets up there, but I'm concerned about it too. This was a case that started about a racetrack, believing they should have a higher capacity. I get a lawsuit on that. We can argue back and forth, but at the end of the day, my hope is the end of that lawsuit, if it changes capacity, still has all the other rules, restrictions, and et cetera in place. It was by daycares that, listen, I think they obviously care about their kids, but I think 28 kids right now, when you see what happened in the football context, is really dangerous. But I get that. But what it became through the intervention of the AG is, let's throw all the rules out. And they ended up subpoenaing our labor cabinet secretary to testify on unemployment and the processing, which doesn't have anything to do with the emergency orders themselves. They then went into a number of topics. I think they ended up asking our Dr. Stack about abortion and a number of other things that seem to have gone on. We had 5 surprise expert witnesses. And so, listen, the judge can run his courtroom as I guess as he chooses, and I'm not going to personally criticize it, but it's really bizarre. It's really unusual, but that creates a record for when it does go up on appeal. We're going to be able to point all those different things out. And so, as a lawyer, I'd say you want to win, right? But if you're going to lose, the more strange things that happen, the better record that you have when you take it up. But no, I'd say personally, I think there were a lot of things that happen that don't normally happen in a proceeding, but we'll get a chance to argue that later. I'm not a criminal justice lawyer. Recovering one.
The first part is there was this document reported kind of analyzing state by state their reopening plans and kind of ranking them in terms of whether or not they're on pace to reopen, cautionary, or if they should just go back to shutting everything down. It was dated July 14th. Have you seen that report? Okay. Well, basically put Kentucky into a yellow cautionary stage and recommended masks in counties and metropolitan areas that rise their cases, closing off bars in those areas, which was most of Kentucky, and limit social gatherings to 10 or fewer people. It's a lot of recommendations. What do you think about those in light of this report that's been put out there?
So this is a question about a report from, I guess, July 14th that apparently shows us in a yellow kind of cautionary zone. And just generally, I think we ought to think that we're in a yellow cautionary zone, that our cases aren't out of hand, but they are increasing, and we ought to be concerned. But knowing that is a snapshot of 14 or so days ago, and knowing we've taken some steps since then, I believe the facial covering requirement is going to go a long way. I think that we are stepping up enforcement of certain areas where we see spread, though we're not getting as many reports out of bars as other states are, and I think that's in part because of the clarity of the mask mandate, and we haven't been open that long. We have some good signs too. I mean, it's important to point them both out, and it says we still have time to get it under control. We still have significant capacity in our hospitals. We still have significant capacity in our ICUs. We actually have a very large amount of capacity on ventilators, thank goodness. But I think saying that we're in a yellow zone where we need to be cautious and make sure that we get a hold of this right now, I think that's fair. That's kind of how I feel. Mark, you want to go through?
Pass to Chris.
Well, thanks, Mark.
You don't get an extra one.
What can you tell us about this football team, where it is, what the details are, and do you think that the Kentucky High School Athletic Association or others should take a step to ban fall sports or maybe move baseball to the fall and football to the spring?
So the question is on this example we're using, where is it and what do I think KHSAA should do? I'm not going to mention the school itself because it could be multiple different ones at time, and I also don't want people to feel punished if they're doing the testing and then actually taking the steps, and then we're learning about it to educate others. But it says that we need to be nervous right now about sports. If we wear masks, if we socially distance, then I think we have an opportunity to move forward with them. I think we're seeing a lot of choices about football right now. I know JUCO moved to the spring, and that's going to be one that we're going to have to be really thoughtful about. There are some lower contact sports that if we get a hold of this and get a hold of it early, we may be able to move forward with, but this is really concerning around the weight room. But for any other information, submit an open records request, and if we have documentation of it and it's an open record, we'll pass it along. I think the community does know, but I don't think, within the state that I want to create a black eye on a team that's probably trying to do the right thing, but it shows how quickly it can get out of hand.
Putting out their plans for the fall. Have you all gone any further as far as the statewide guidelines?
So we have put out our statewide guidelines, but superintendents make these decisions under their authority. We've got really clear guidance out there. I think a whole lot of superintendents were watching what happened today, knowing that a different decision could have had major and severe ramifications. So right now I think districts have to grapple with a number of questions. Number one, in their facilities, can they spread people out enough to do this safely? And that can be tough because we've underfunded education for so long. Number two, looking at their teacher workforce, how many of them are at risk, and making sure that we don't put our teachers in a position that is unsafe. Number three, what type of hybrid models are possible where you're in a certain amount of days and out a certain amount of days, and can you cut down on your density? And then I think that there are some other questions about the when to start. Do you give yourself a little more time? Do you go ahead and start on NTI? None of those decisions are easy. And listen, I feel for the superintendents. I've been where they are. And I think that they're all taking in all the information, and parents need to know that if you made this decision 2 months out, you're just putting out what you think is going to happen. And so I want to make sure I communicate with them and be generally supportive. If somebody makes a decision I think is dangerous, I'll talk to them first, and I may talk to everybody else second. Morgan.
When we started reopening the economy in different places, I think there was a general expectation that would mean there would be obviously more spread than everywhere else was staying at home. Has the escalation that we've seen, is that more than what you expected to see? And if so, what do you attribute that to? Do you attribute it to lack of mask wearing or what have you? And why the 5% threshold for you?
The 5% threshold is one that the federal government and others have talked about. That's a questioning us about that and why that concerns me at reopening. But the question is, we knew, and I've talked about, that we would see more cases as we reopened, and we did initially. We hit a plateau where we were within 150 cases on any given day, and it stayed about the same. And that was at a place where we could really manage it, where we had enough hospital beds. We saw, generally, I think, deaths diminishing. Those also depend on who catches it, and that's a difficult truth of the virus. But what we are seeing lately is an escalation that we've got to stop. It's more than we ought to be seeing, even with a properly reopened economy. But that presupposes what's driving it is some of the reopenings and not getting together with huge amounts of people, not refusing to wear a mask, not having a mask requirement in effect, which I didn't, and we do now. I can actually look back on specific dates, and we were really committed up to about May 1, and then we were tired. And maybe getting out more, maybe some of the reopening impacted it. We saw just a little bit less. And then June's kind of a tough month. I think a lot of people were really tired. But I think everybody has woken back up now. And during those months, we didn't have something like we're seeing in Florida and Texas and Arizona. Maybe some thought that we were weathering this in a way, and maybe it might peter out. It's not. So I think all of those have an impact, but it also says that, like I said, we ought to kind of consider ourselves in that yellow cautionary area and watch every single day. What it also shows is everything we've put into place we have to have. Right? We allow a little more contact and we see our numbers going up. And it suggests some things that we had in place when we had a travel ban. They were helpful. That's going to be complicated now with some federal court rulings that have been there, but we got to look at all options as we move forward.
Florence openly flouting mask mandate and physical distancing guidelines. I think you've alluded to it this week. I haven't talked much about it. Would you like to comment on that case in particular? And also, I'm curious if bars like that, bars and restaurants like that, violate guidelines repeatedly, are they at risk of losing their alcohol license?
So the question's about a specific bar in Florence that made a nice hello video to me, I think, and put it up online. And I've been called worse, and that guy doesn't know me. I mean, he's upset and probably scared about what we're going through right now, and I don't take that personally from him, but watching everybody in the video, linked arms, no masks and nothing, that worries me. Because, if one person gets people riled up and says, oh, they're violating our liberty, everybody jump together, get as close as you can, and a whole bunch of people get COVID. Right? That's something you can't undo. You could have felt really strongly about what you're saying, but you can't undo the ramifications of it. And this isn't just one where it'd be different if it just put yourself at risk. If I decided, my firm belief that I shouldn't have to wear a facial covering is so important that I will die for it. Now, people might feel that, wait until they're on a ventilator. But if it only affected them, it'd be a different story. But this doesn't. This affects everybody around you, including those who choose to wear a mask. I've said it before, when you look at your rights, you have a right of free speech. But you can't run into a crowded movie theater and yell fire. Your rights end because they are putting other people at risk, and they have inalienable rights too. That's my non-practicing lawyer coming out. Did I miss the second part of that question? So these are now requirements, and they're in effect. If a bar, any bar, and I don't want to talk about this one, or a restaurant, any restaurant, simply refuses to enforce the mandate, then yes, there are escalating penalties that could include closure. But the reason that the facial covering requirement is going to work is that it's clear. No shirt, no shoes, no mask, no service. And it takes it off of them, right? And I will take the fault for the people who are mad. I don't want anybody yelling at that cashier. I saw one of somebody in a gas station who was really mad and cursing and saying he just really wanted to buy his cigarettes, which it would be tough in a mask. But that person didn't put any of them into effect, right? That's just yelling at your fellow human being. Let's be better than that. I get that we're frustrated. I get that we're scared, and we all are. But let's be better than that. One here, I was reaching out to see if Governor Beshear or Secretary Freelander have a response to the news that Molina Healthcare will be acquiring parts of Passport Health here in Kentucky. Limited in what I can say because there is still a challenge to the awards from Passport. But if it goes through and if that's taken care of, and if it means that individuals can be transferred and don't end up losing coverage and falling through the cracks, that's good for them. My understanding is it creates the possibility for a regional headquarters of a multi-billion-dollar company in West Louisville, and that could be a very exciting prospect for that community. Otherwise, I can't comment on any of the details. All right, Tom.
What is the purpose of the Franklin County court case, making the Attorney General file everything in the Franklin Circuit?
The Franklin Circuit court case is one that our administration went ahead and preemptively filed. Every other one of the rules had been challenged at the time that we had done it. But at the time, there wasn't a direct challenge, and any complaint on certainly on the facial covering mandate, and then just everything. And these cases are almost always decided in Franklin Circuit. And I just wanted to make sure that we did it in the place where these things are always decided, and we're not trying to pick and choose a certain jurisdiction where we think that we might get a given result. I don't necessarily think that's the case in any of them, but Tom, you've been covering a lot of lawsuits because I've seen you there. And they've all been in Franklin Circuit before, haven't they? Yeah.
You know what I mean? They're being specifically chosen in the venues that Cameron and others have chosen.
The question is, do I have any idea why they have been filed in the areas that they've been filed? I know the claims are that some of the businesses are in that area, but certainly lawsuits on the powers of the governor between the Attorney General and the governor have almost always been filed in Franklin Circuit. We're sitting in Frankfurt right now, and my office is here, and the Attorney General's office is over there. And Franklin Circuit is half a mile from us, meaning that you can take the least amount of time out of people's days, and hopefully he can go back to fighting human trafficking and child abuse, which I want him to do. There are things that I care deeply about. I can go back working on economic development and fighting COVID-19. That's the way that we can and we should be doing it. All right, folks, as we wrap up, based on the Supreme Court ruling today, all these safety measures are still in effect, so please follow them. Listen, they're not they're simply to try to protect each other. And if we do them, if we follow them, if we wear the facial coverings, and if we want to do it too, gives us our best chance to save lives and protect the health of Kentuckians. $10 billion of our economy. Gives us our best chance to get back in schools, and even the Surgeon General said, heck, it gives us our best chance, not just at the sports around us, but even college and professional sports. So we're fighting a 1 in every 100-year health pandemic. Can't we take our arguments that we would otherwise have and put them off until after there's a vaccine? I hope so. I hope with your neighbor, I hope with those that you might get frustrated with, you remember that we are living in a historic time where we really have to look out for each other, to be compassionate and to be kind. And I'll just say after the last couple days, I'm tired, but I'm still committed. I took on this job not knowing that I was going to face this, but having the ultimate responsibility in a time like this to do the best I can to save people's lives. It's all that I'm doing this for, and at the end of the day, when it's all over, I will accept all Monday morning quarterbacking and judgment and any of the rest. That's fine. But let's get through it. Let's save each other's lives. Let's do the right thing. Let's protect our economy, and we'll worry about the rest later. Thank you all very much.